Our second and final speaker was passed over for Lieutenant Commander mid-Navy career. Although he made it the next time around, he was assigned to the Fleet Numerical Meteorology and Oceanography Center here in Monterey and led the implementation of a new weather computer graphic system worldwide, putting him on the forefront for his next promotion to full commander. Instead of being assigned to the USS Kitty Hawk as a junior new lieutenant commander, he eventually went instead to the nuclear-powered USS Enterprise following his fleet tour and quickly made commander. Please welcome Carl Thormeyer delivering his number 7 speech, a 7 to 9 minute speech titled "The Health Care Debate, the Issues."
Thank you, Madam Toastmaster. Well, the status of the national health care reform as proposed by the President and being considered by the Congress has been the talk of the town, or more correctly, the town hall meetings that we've had over the past couple of weeks, and I listened to 2 of them earlier this week. The dialogue has been very interesting, and it has encouraged a lot of polarization that is probably the worst I've seen since the Vietnam War, or perhaps since several years ago past President Bush suggested a change to the Social Security system, and the other side was all up in arms. And now the shoe seems to be on the other foot. Well, today I want to look at the driving force for health care reform, the currently proposed solution, and the problems with that solution. This is actually the second of a series of 3 speeches that I'm giving on this topic, any one of which I hope will stand by itself. So let's start with the driving force. Well, the driving force is that I think many of us can agree that the healthcare and health insurance situation here in this country is irretrievably broken. It's not working the way it was originally designed to work. First reason is that the system seems to reward quantity over quality. You're more likely to be able to go and get all the tests for something, whether you need them or not, rather than the preventive medicine to get through ever having to have the tests in the first place. So there's no real incentive not to use the system, and perhaps we're abusing health care that's available to us. Further, there's no reward for stressing prevention and healthier lifestyles, and the President is very concerned about this. Well, the second item of the driving force is that the people that need insurance the worst don't have it or can't get it. For example, the unemployed, or perhaps people recently laid off, people between jobs. This is very tough for them. I'm not talking about the indigent because they have Medicaid and other so-called, what would you call it, you fall into I'm having a senior moment here, safety net, thank you, Art. So I'm not talking about that. I'm talking about the people for whom there is no safety net. And the third driving force is that costs are totally out of control and threaten to sink us all. Not only in the cost of private insurance, the cost of the medical bills that come along with hospitalization and care, but Medicare also. Medicare is already, as of last year, taking in less money than it is spending, and by 2017 is expected to be totally insolvent. So we have cost problems with the existing healthcare system. So a number of solutions has been offered, but the one that's making the news these days is a very complex bill called the Waxman-Pelosi House Bill, which is House Bill 3200, and which has been a subject of Congressman Sam Farr's town hall meetings the last few nights, and will continue to be. Now, some of the problems, some of the issues with this is that, first of all, this bill is 1,100 pages, over 1,100 pages. Can you imagine that? Of complex rules, procedures, and bureaucracy. And the President wanted Congress to vote on it with only 3 weeks to take a look at it. And that didn't fly, quite obviously, and so it's still in process. It seems to be extremely controversial, and there have been a lot of complexities associated with this bill that have resulted in misinformation. People are raising arguments that are really totally either unrelated or just don't exist. The classic case being the so-called grandma death squads that the government's going to set up to determine whether your grandmother should get care in the final months of her life. And I understand the Senate just took the paragraph that people turned into that argument has just been taken out of the Senate bill, so hopefully that won't be an argument anymore. But it's this kind of thing that has made it very controversial and confusing. And so people are concerned and they have problems with the current solution. And I want to talk about some of those problems as I've seen them here recently. First, of course, the public reaction at the town hall meetings. Certainly not organized. A lot of this is maybe organized, but a lot of it isn't. It's genuine feelings of the people. Secondly, public reaction in the polls. Now, Charlie Cook, who is a political editor for the National Journal and also writes for Government Executive Newsletter, quote, a few weeks ago said, polls clearly show that Americans want to overhaul our health system, but their preference is for the Obama administration to slow down and proceed more methodically. Slow down and proceed more methodically. So that's one issue. Another issue I just found out about the other day is that the president has proposed computerizing all medical records so we can easily follow our medical process from one doctor to another and hospital to hospital. And this is a good idea, but just the other day, Google and Microsoft executives criticized the Obama e-healthcare record plan. And this was in an edition of the NextGov newsletter on technology and the business of government. And I have to paraphrase this because it's a little longer than I have time to quote, but basically it was that the Google and Microsoft executives were saying in response to the administration's plan to better computerize medical records and access to the same, that these executives said that the plan would use an outdated system of databases in a web-focused world, stifling innovation and forcing continued use of outmoded systems. So could it be that perhaps this part of the bill was written a little too hastily without thinking about the future? I don't know. And then there are assessments by various national news magazine commentators. Now, one of the commentators in Time magazine, his name is Ramesh Ponnuru, just last week, the 17th of August issue, had a series of issues, and the title of the article is Obamacare's Fatal Flaw. Democrats claim their plan will save money, but they have too many conflicting goals. And so some of the conflicting goals, first of all, President Obama himself, in speaking about the plan, said in one speech that the status quo is untenable, there are skewed incentives, the focus is on quality or quantity vice quantity, and it's bankrupting families, businesses, and government. And then later in the speech he said, well, if you're happy with your plan and your doctor, you don't have to change. So the message we get here, okay, the system is unsustainable, but you can keep your piece of it if you want. Another conflicting goal is the president promises to cut costs while simultaneously proposing coverage to 50 million uninsured and by raising taxes. So people are a little conflicted here with this. Another confliction is that the Congressional Budget Office says that the leading healthcare reform proposals will increase healthcare spending, yet saving money is the president's principal stated rationale for reform. And then another conflicting goal is that, well, we want to make sure the young people coming out of college is getting a job that they're able to afford insurance, that they get insurance so we can keep them healthy. But on the other hand, we want them to spend, they're going to end up spending more on the system than they get out of it because they're young and healthy. So the quote from the article is, is reform something we're doing for them or to them? Well, I'll let you draw your own conclusions on all of this. But the moral of the story is that, yes, our health insurance system is broken and needs fixing. Doing nothing is not an option. But we don't want to commit to the unknown, and certainly it takes a while to go through 1,100 pages. We want to know what we're getting into before voting it into law. The present proposal, I feel, has too many fatal flaws and conflicting goals. We need a carefully measured response, a thoughtful solution that is simple, manageable, and affordable. And we're not there yet. We need to take the time to do it right. And that's my message to my Congressman Sam Farr. And if I get a chance to do another speech on this subject, I will give you my proposal.